Welcome to 5-Minute Health Tips. In today's video, you will learn 9 foods to avoid to improve prostate health. Prostate health issues are very common in men. Some of us may even think that it will irremediably grow and cause problems one day. While it is true that prostate enlargement is a normal part of aging, not everyone experiences its symptoms. If you have any type of prostate disease, avoiding these 9 foods may help your prostate health and relieve your symptoms. In many cases, not consuming them may also prevent prostate disease in the first place. The 9 worst foods for prostate health you want to avoid are: Number 1. Alcohol. Heavy alcohol consumption has many health consequences, and one of them includes prostate health problems. Studies show that alcohol increases the severity of lower urinary tract symptoms. They include weak urinary stream, incomplete bladder emptying, and difficulty to start urinating. The diuretic properties of alcohol make this type of beverage even worse for patients with prostate problems. Thus, it is wise to avoid heavy drinking or quit alcohol consumption. Number 2. Eggs. For many years, we thought that cholesterol in eggs was terrible for our health. New scientific evidence showed that dietary cholesterol does not affect serum cholesterol that much. However, other components of eggs may affect the prostate in the long term. Recent findings suggest that choline in eggs and its metabolite betaine increase the risk of lethal prostate cancer. Higher choline intake could increase prostate cancer risk by up to 70%. Indeed, choline is not only abundant in eggs. Milk and meat are both rich sources, too. Thus, it is not a single food, but a pattern of eating that we want to avoid. Number 3. Caffeine. The problem with caffeine is similar to that of alcohol. They both have diuretic properties and increase the urinary volume. Moreover, caffeine is an irritant of the urinary tract and causes additional symptoms that alcohol does not trigger. Thus, patients with lower urinary tract symptoms, LUTS, should ideally avoid consuming beverages and foods with caffeine. Preliminary studies also suggest that caffeine increases testosterone and DHT levels in the ventral and dorsolateral regions of the prostate. If that is true, caffeine may also contribute to benign prostatic hyperplasia and prostate cancer. Number 4. Spicy foods. Anyone with urinary problems should also stay away from spicy food for the prostate. While caffeine is diuretic and mildly irritant of the urinary tract, chili and spicy foods are strong irritants. They can potentially worsen any urinary symptoms you may have, especially urgency and urinary incontinence. Certain components of spicy foods can be beneficial for the prostate, especially capsaicin. However, it is not recommended to eat the whole food with the rest of the irritant substances. Instead, you can try using prostate supplements and avoiding spicy foods to reduce hypersensitivity in your bladder. If you like the information you're getting so far, we appreciate if you will like, subscribe, and share. Now back to the video. Number 5. Saturated fat. In general, it is a bad idea to consume foods with a high proportion of saturated fat. Prostate health is not an option in this particular. Saturated fat has a very high inflammatory potential. It does not only favor inflammation but creates the most aggressive type of inflammatory cytokines. We know that cancer feeds off inflammation, and that's a fact. It uses inflammation to keep growing and feeding new prostate cancer cells. Thus, it is only natural that saturated fat increases the risk of prostate cancer. Studies suggest that a diet rich in saturated fat increases the aggressiveness of prostate cancer. In other words, these patients have a more dangerous disease with rapid prostate cancer progression. Number 6. Sodium. People who prefer eating high sodium foods for better taste are at increased risk of prostate-related symptoms. According to a recent study, they increase voiding symptoms such as low urinary stream and incomplete voiding. Storage symptoms may also worsen, increasing your urinary frequency and causing nocturia. Ideally, we should avoid sodium and use spices instead. These are safer and provide extra benefits such as anti-inflammatory and antioxidant substances that sodium does not have. Number 7. Processed foods. It is a fact that processed foods increase the risk of many types of cancer. One of them is prostate cancer. Based on information gathered in Montreal, Canada, from 2005 to 2012, the ProTERS study evaluated the incidence of prostate cancer and other types of cancer and the consumption of processed foods, mainly processed red meat. In short, the more processed foods people consumed, the more likely it was to suffer from prostate cancer. Processed foods include fast food, convenience food, canned foods, microwave-ready dinners, commercial beverages, ham, sausage rolls, cakes and biscuits, pastries, breakfast, and much more. Number 8. Salad dressings. In many cases, salad dressings are anything but healthy. Most of them fall into the category of processed foods because they are packed and filled with chemicals. Additionally, they are often salty and rich in saturated fats. There's nothing healthy in commercial salad dressings, then. Instead, we could use spices and olive oil. They provide anti-inflammatory and antioxidant substances that will be beneficial for our prostate and overall health. Number 9. Red meat. Unprocessed and processed meat has raised concerns as the incidence of cancer is increasing around the globe. High red meat consumption is considered a risk factor for prostate cancer. Many studies talk about carcinogens in red meat that activate or are generated depending on the cooking method. Red meat cooked at high temperatures, cooked until well done, and by pan frying causes the highest risk of prostate cancer. The reason is not apparent, but it is probably due to heterocyclic amines present in red meat under these cooking methods. Unlike this type of meat, poultry does not appear to have the same effect, and fish has a protective effect because it is rich in omega-3 fatty acids. The prostate tissue naturally gets bigger as we grow older. However, not all of us experience BPH symptoms. Thus, keeping a healthy prostate does not only depend on genetics or your age. It also depends on what you eat. Dietary habits and lifestyle play a significant role in preventing prostate issues and controlling the symptoms if we already have them. This video is for educational purposes only. There is more information regarding this topic. Please consult your medical professional. Thank you for watching, and don't forget to like and subscribe. All the best from the 5-Minute Health Tips team.